Hi, I'm Dr. Rajani. Thanks for joining me today. I'm going to let you in on a secret, something I do in my clinic to create facial shaping. We talk about many things on this channel, piecemealing, cheeks, lips, chin. If you want to look natural, you want to look youthful, and you want it done without surgery, you want to watch this video. To demonstrate my points, I want to show you a couple people that you might know. Let's first look at this picture. Let's take Kylie Jenner. Okay, what are you seeing in this picture? One of the things is, in the after picture, a more defined jawline. Where? At the lower edge of the mouth. Just above the mandible, or at the edge of the mandible and superior, is that contouring. And that is what everyone wants. It also, when you don't have that or you have a heaviness, it creates the RBF, or resting B face. Okay. Now, if we take another picture, I want to look at J-Lo. So if you look at J-Lo from many years ago and to now, what is it that she's maintained that we believe that she looks so good for? A lot of times the jawline, but it's above the jawline at the edge of the mouth. That's what's giving an aging look to people. Let's move on here. Let's look, for instance, Meg Ryan. So if we look at her, we can see as she's aging, from her youthful pic, you can see she started off with a heart-shaped type of face, but she had an element of squareness at the posterior jaw, and that leads to heaviness where? Above that mandible. It's one of the hard things to get away from. We look at a male, let's take a look, most recently Ricky Martin. Now he said it was from an IV therapy, he was bloated. It gives us a window into aging though. For men, it's the same, it's the lower face aging. So that's what I'm addressing in this treatment today. Let's look at Madonna as another example. Now, she had some pics which ended up being filtered, but in general, she did have a nice V-line jawline. At the MTV Music Awards, many people said, hey, there's too much in her cheeks. She had the pillow face back. But today, I'm focusing on the lower face of the jawline. Her jawline looks good. She's 63. That's not a natural 63-year-old jawline, but to demonstrate to you that it's one of the looks that's in, it's trending, and the mind, as I'm saying, is calculating the math of beauty, and that's part of the math as demonstrated by Madonna. The implications aren't just for those who want injectables or more invasive treatments. The concepts today are also for those who are using skincare, devices, home yoga, rollers, all of those things, all of those treatments, all of those devices to try and do what? To make someone look younger. The concept I want you to think about is that the eyes look, but the brain sees. So no matter what you think, you're calculating. The brain sees and calculates and sends a message to you. So when you're watching me here today, you're going to say, I'm going to get comments, Rajani, you're looking good. You've lost weight. What happened? You look tired. You're looking a little older. I get those comments all the time. I was just in 4 countries, 2 conferences. I'm jet lagged. You're calculating things about me right now. One of the things you calculate is facial shape. There's many things that go into, for instance, am I tired? You're going to look at the eyes. You're going to look my body position. You're going to look at my energy. But one of the things we look at to determine beauty, and no matter what, people calculate, yes, whether you're tired, whether you're energetic, but also beauty, and it affects people's lives. It's why social media has gone through the roof, the algorithms and social media. But facial shape is what we're talking about today, and we know the heart-shaped face and the oval are the number 1 and 2. How do I achieve that in clinic? And why is it that you can't go everywhere and get that type of treatment? I'm going to show you a combination treatment that I use. Not one company can go in and train someone on this. I'm using 3 totally separate treatments. I'm going to be using the upper face. You could do the mid face. In this patient, we're not going to need to do that. And we're also going to treat the jawline and the neck to get that facial shape. I'm also going to talk about price give you full information. What would something like this cost a person? If you like these videos, remember, subscribe and like, and if you click that bell, you'll be reminded of all the great upcoming videos when I upload them. Always on Sundays, but I throw in a lot of other videos when I have a chance. Now, as I said, there are surgical options. What I'm going to show you today in my clinic is non-surgical. It's what 95% of people want. But if you look at this picture here, it's of the skull, but it's showing what can be done with the jawline. And you can get crazy. You can go into surgical procedures, which isn't crazy to a lot of people, but in this country it's not that common. Overseas in Asia it's very common because facial shape is even more important, it seems to me, over there. But you can cut the bone. You can bring the chin forward to get a genioplasty, what's called a sliding genioplasty. You can shave the bone off of itself to create that shape, and the bone can be grafted back to also create what's called the V-line. You might know the V-line. I have videos on Korean V-line just because the shape's important. Let's go into my clinic and I'll show you a combination treatment that I do. Now, it's what I choose to do. It works for me, it works for my patients. What the patient we're going to see today is a classic age group that comes in, 25 to 40, okay? I have many videos on 50 plus. If people think 50 is old, whatever old is to you, but many people say, this girl I'm going to show you now, she's too young to get procedures. Remember, if you come in at 50, 60, 70 and you look that age, as I showed you some of those pictures, you're going to need surgery. Now, no one needs aesthetics, but you'll need it to get the look that's in your mind, to get the look that your mind calculated. Remember I said, we look with the eyes, we see with the brain. The brain calculates it. When you come to see someone like myself, you have an idea of what you want to look like, whether you know it or not. I get it all the time. I want conservative. I want a conservative look. No, you don't. Because when you go home and it's all said and done and it's conservative, you're like, I want a little more. So be honest with yourself when you talk to your practitioner. People who are younger, they're on Instagram, they're on social media, they know if they take care of things, they never have to have that 5, 10, or 15 years of sag, of jowl that they don't want. And if they want to get surgery down the road, it's much easier and it's an easier transition. They don't go from looking 55, 65 to now looking 30 after the surgery. And I'm using chronological age, as all of my regular subscribers know. I don't use chronological age, I use skin age, but making it understandable in my concepts to you, I use chronological age here on this channel. But it's skin age because I have 70-year-olds that look 40 and 40-year-olds that look 70. So the first thing we're going to get is a 3D image. And I love these because you get to follow people. I have them from 12 years ago from some of my patients. That's when I started using this technology. The software is better now, but I get to follow the facial shape and all the particulars of the face, the browns, the fine lines, and the wrinkles. And I can see, what are we doing after 1 or 2 of these treatments? Are we making headway? Do we need to switch gears? Do we need to stop? Because it's a great way to get an accurate image. So this is the image of our patient today. Now let's go to the treatment and I'll show you what I'm doing. Now there's many ways to do this. Each clinic has their own. I'm just sharing what I do, what's successful for me. The first thing is I'm using a biostimulator, and this is Sculptra, highly concentrated on a certain level in the body so that it reproduces the volume that someone needs. But remember, a biostimulator is also a skin tightener. So if I follow my images over time, I watch the tail of the brow lift, especially after 2 treatments. Some people get away with 1. She looks great, she'll probably do fine with 1. It's the safe injection technique is key, but I love Sculptra in the temples. Of course, I teach particulars of all these treatments on my AMIT, the virtual training. A lot goes into knowing all the layers and what to do, but know the concept that if we're trying to create the shape, people call it the egghead, the peanut head, whatever it is. I don't like all those terms, but we're trying to add volume to the upper face. Now, you could make a case for a lot of people to add cheek filler. In this particular patient, I didn't think it necessary, but Remember we talked about genioplasty, sliding genioplasty? This patient has a nice chin projection, but if we look, I'm adding some volume at the Begonian. The Begonian is at most anterior or forward projection. There's many ways to use this product here. I'm using hyaluronic acid. You can put it on top or below the muscle, knowing the anatomy and the vessels are important. The vessels do communicate to the tongue, depending on the depth you're at. So it can be dangerous, and it's important to know what's there. But aesthetically speaking, bringing the chin forward a little bit creates what I always talk in the videos is the anterior tilt of the face. And the anterior tilt is an attractive feature. So if we can bring things anterior and slim the jawline, it's a win-win. Now the third part of this particular treatment for this patient involves RF microneedling. So many questions are going to be on this. I want you to watch what I'm doing here. This is my last of 3 passes, and I'm going to a depth of almost 4 millimeters. And you'll see she'll start to bleed. We're deep here. And what I am targeting fat. The most asked questions about RF microneedling, is it going to get rid of my facial fat? Sure, if you know the settings, you know what you're doing. Look at the depth I'm going to, because I want to slim the jawline. There is some fat that I can get rid of, and I do it in 3 different layers so I can tighten the skin. She's fairly young, she has great skin, but we can still tighten it all to slim the jawline. You saw the look of Kylie Jenner in the beginning, how that picture looked. And just by tightening and removing some of the fat, and then the submentum, because if you can make that mandibular angle strong, bring the chin forward, lift the eye and the top of the face. This case we didn't have the cheek filler, but you could. I didn't think she needed it aesthetically. And then slimming the lower face. Could this be done surgically? Sure. Does she need it for her result that's in her mind? Remember, you don't need aesthetics. She doesn't need it. In my opinion, I'm going to get a result. Maybe even with 1 treatment. They usually purchase 2 to 3 sessions. And the older someone is, or the more chronologically, we can use damaged skin or aged skin or whatever you want to use that you're comfortable with, the more treatments they're going to need. And even if someone has surgery, I do these post-surgical, because a lot of times people want more result than what they got with surgery, but don't want surgery again. Now, cost. What would this cost? Understanding in one's mind that to look unnatural can be pretty inexpensive. To look natural, which is my goal here, gets more expensive. Sculptra Temples concentrated, I used about 2.5 cc's concentrated per side. That's, think, $1,000. This case we did not need cheek fillers, so that would be $0. We didn't need pre-auricular or in front of the ear, that is $0. But we did do chin augmentation. In this case, I actually just used half a vial of filler. She didn't need that much. And in the depth I was able to put it, not everyone can add to that depth because of skin quality, but her skin quality is great. Half a vial of filler, think about $600-700. And that's an integrating type of filler that's actually FDA approved for the chin in this case, not that that matters to many people. Some people need 2 or 3 vials, so that will increase costs, but in her case, think $500, $600, $700 USD, US dollars. And then if you think the device is $1,000 per treatment, and I do not use this device for the upper face, I use a different device. I'm literally using this device for one thing. That's lower face and submentum. I don't even treat the lower neck with it. I have other devices. I like to preserve the fat. There are settings with an RF device that you can preserve the fat. I just don't use it for that. I have better treatments. And that would be $1,000 per. Most people are going to do about 3. I could see her doing 3. Why? Because I don't want to do a lot of filler. I don't want to make her look unnatural. I don't want to bring the chin forward. And this is going to be permanent down here. Why not do it now in the 30s? And then you might be done for many years, 5, 10, 15 years, if living a healthy lifestyle. So think anywhere about $5,000 plus. And most things nowadays, when you go into a medical spa, an aesthetic practice, a minimally invasive clinic, most ticket items you're going to purchase to get an overall look that's going to look good is $5,000 plus. It's the new norm. It is what it is. Other countries can be less expensive. Product costs and medical costs in the United States is high for many reasons. Talk about tort reform could be a whole other video. That's a great way in my clinic for my skill set to get a great V-line look and prevent aging and reverse the signs of aging. I know you might have many questions on this. I look forward to them in the comments below. Please like and subscribe. I put a complete playlist here on things that you can do at home with skincare to keep your skin and body beautiful, healthy, and vibrant.